So some of the most important parts of the survey was the themes that people wrote. And there were pages and pages and pages of things that people were able to add comments to. And so I just wanted to, I took that document and I kind of pieced it apart and tried to come up with like 10 common themes of what people talked about. And the first one was that we want to be recognized for the work that we do. And I think that probably everybody in the room agrees with that. Another common theme was the term mid-level. It can be offensive and doesn't reflect a professional role. I was surprised myself actually at how many people did not like that term. So hopefully one of the goals of this council will be to figure out what to call ourselves. Another thing is we want to be utilized to the fullest capacity that we can, that our license and certifications allow us to have. We want professional networking with our peers. Many people talked about how valuable that would be. And Ann talked a lot about how we're all very smart in our own specialty areas, but it would be nice to have some role development and some professional development in regards to, from an institutional level as well. We would like to have an infrastructure developed for our group, similar to what nursing does and medicine has, but more specific to the PA, ARNP, and what some of the comments that were in relationship to this include, you know, just a channel to go to when we need stuff, or when we have questions about our practices or our licenses or anything really, orientation, any of those things. You know, we don't have an infrastructure in place. When we hire a nurse practitioner, it depends on who's paying us, you know, which category we fall in, you know, whether it's medicine or whether it's nursing. And it would be nice if we had a separate place where, you know, some place that housed us as a group. Another common theme was UIHC investment to educate patients about the roles that we play and how we benefit them. One of the things that our particular group in the, you know, Women and Children's Services and the NICU, we have patient satisfaction from the Press Ganey reports, but nowhere on there does it ask about nurse practitioners or PAs, and so we, you know, would like to see some reflection, you know, about us in the patient satisfaction surveys that go out. Maybe your other areas have that, I don't know, and if that's the case, then it's good because then we can network together to come up with ideas that would apply to all areas. Another common theme, visibility through marketing and communication venues such as websites, directories, commercials. You know, a lot of times we're listed under insurance companies as providers, and I don't know about many of you, but I frequently will get calls from patients that move into this area that want to know if I can see their patients or if I can see their you know, children or their families. And so just having an avenue to kind of you know, send those kind of calls. I'm a pediatric nurse practitioner and a neonatal nurse practitioner. I practice as an NNP, but I'm probably listed as a PNP. We don't have a primary care pediatric nurse practitioner service here at the university, but maybe that's something that we could look into. Those are just ideas in regards to some of that marketing. Other things, you know, I have this vision, and my staff probably are going to laugh, but I always think that, you know, when you get off at exit 242 and you're driving down the road, you should see a big billboard with all of the nurse practitioners' faces, because, you know, we're the ones that take care of the newborns in newborn nursery. Not alone, you know, of course, with other people, but just that kind of marketing, have our faces out there to be the faces of the university that are taking care of the patients here. More involvement and voice in some of the UIHC committees, more professional development, time, ability for research, publications. I'm amazed at some of the things when I see a nurse practitioner name, I sit on the PA ARNP committee, and just, you know, for fun, sometimes I'll Google whoever it is that is going to get credentialed, and they are amazing. You know, they have a lot of publications, they have a lot of stuff that they have developed, and just, you know, advertising that and marketing some of that, or even giving them time, you know, 5% of their time, or 1% of their time, or 10% that they can actually expand on that kind of stuff would be really nice. You know, we are the group that takes care of the patients, we're the front line. So, again, those are just some ideas that was pulled out from the themes. And then the last thing was the development of the ARNP PA Council. You know, people liked this idea, and I hope that we can, you know, there's 208 of us, and, you know, I don't know, there's probably 40 or 50 of us here. Hopefully we can go out and talk to our colleagues and encourage participation so that we can get, you know, it's going to take all of us. So as far as just some of the other highlights for this talk, and I know that we're on a time crunch, everybody's busy, but we do have over 200 NPs and PAs employed here in this organization, and we are virtually in every service here at the hospital. We are inpatient, we are outpatient, we have subspecialty care services. So, you know, Ann made a good point that even though the CRNAs and pediatrics probably hire the majority of nurse practitioners and PAs, they're all over the place, and you know, the one or two that are in each one of the departments probably feel rather isolated. But when you put us together in a group, we're a big, we are a big group of people. So she also talked about some of the benchmarking and some of the webinars that are out there, and when you look at some of those, they have amazing data and great ideas that we need, that, you know, probably many of us in pockets do here at the university, that would help us, you know, kind of guide the light for structuring ourselves. I pulled out some highlights from this particular project. It was called the Mid-Level Provider Benchmarking Project Findings. There were 25 organizations that were involved in this particular study. We were not one of them, but it was a webinar presentation by Kathy Krasek, and the focus behind studying this group of people, the ARNPs and PAs, were based on four things, and the first one being complex billing and reimbursement issues, increase in utilization of this group of people, ARNP meaning us, you know, PAs, due to resident work hour restrictions, difficulty in monitoring or quantifying outcomes based on our care, and the need for cost-benefit data. So some of the priorities that this group hopefully will have, and that we can, you know, base some of the findings from those webinars, include organizing ourselves on some level, and, you know, to start with this through this council. And I'm open for ideas. Ann's open for ideas on other ways to do that. But making ourselves more visible through advertising, directories, patient satisfaction results. You know, if we ask the right people, I think we would get a lot of really good feedback on the kind of work that we do. Orientation and training. You know, because there are very few of us in different departments, sometimes our orientation and training can be a little bit disjointed. I know myself, I have 20 nurse, there are 20 nurse practitioners that work in the NICU, 10 PNPs, 10 NNPs, and we have a pretty, you know, structured orientation program right now. We've taken that orientation program and tried to help other departments, you know, apply. Josh was one, you know, from surgery when he was hired, you know, his department contacted us, and we tried to help apply those kinds of concepts. And we can only understand, you know, we kind of assume that maybe other departments have certain, you know, orientation or training things that could help benefit, you know, all of us in all of our institute, in all of our subspecialties. And then credentialing. Credentialing seems to be a issue of concern also, from the time that you're hired to the time that you can actually practice. Sometimes 3 to 6 months can go by before you actually are credentialed, and so you're on staff here as salary, and you can't even see patients. And so those hopefully are some of the areas that we can focus on to streamline. The credentialing packet is lengthy, you all know, because you have had to fill it out. The billing packet is also very lengthy, and the billing packet has a lot to do with where you were at residency, and you know, a lot of stuff that is physician oriented, and hopefully that could be streamlined so that it could be just, you know, just to meet our needs, because, you know, that's, you know, we're a big enough group that we should be able to develop a document that meets our needs. And then another priority that I think we should have is outcome measurements from a patient perspective and a financial perspective. It's really hard to evaluate